전 닥터 하라고 하고요.
He's
제
Mr. Dr. Ha.
제 경력은 아마 2002년부터 앞토스 스레드를 시작으로 실립등을 했습니다. 전 거기 성형외과 의사로서 바라보는 실립등에 대한 관점에 대해서 여러분하고 제 경험을 좀 공유하고 싶습니다.
He's doing the surgeon as a plastic surgeon since 2000. 2001년이요?
그건 2002.
2002, and he's really interested into lifting thread and lifting thread skills. So he will gonna share you through with the presentation today.
먼저 초대하신 그랑 Aespio 관계자들께도 감사드립니다.
Thank you for the Grand Aespio staff for inviting to all of you to into this clinic today.
바로 실전으로 가기 전에 어떤 해부적인 거 간단하게 좀 얘기를 하고 지나가면 좋겠습니다.
He will gonna do the short presentation before do the actual lifting skills. So,
혹시 anterior face와 posterior face가 있다는 걸 혹시 아시고 계십니까?
have you ever known for the anterior face and the
Posterior face.
posterior face?
In anterior face, there's cavities, orbital and oral cavities. There is a facial muscle overrides anterior faces, and because of that, there is a movement. Movements makes aging, like sagging. So rejuvenation surgery is to improve the anterior faces. Posterior face is just for passage for the thread lifting. 먼저 다음 에이징 프로세스를 살펴보면 제일 먼저 시작되는 게 보니 리섭션입니다.
This is for the aging process. So
There's anterior maxilla. There's big bony resorption here, and jowl area and orbital areas. Because of this absorptions, deep fat is going down, and then superficial fat migrates to the gravity portion. Like this, malar fat pad descend, and medial cheek fat descend, and nasolabial fat pad will be aggravated, and then jowl fat will drop too. So, best indications, 30 to 40 year patients. At that time, bony resorption is initiated. 50 to 60 is there is some deflations. Because of that, we need to fat injection or other procedures. For these patients, if we do the thread lifting, the effects last shortly. She is in her 30s. At first, zygomaticus action is hyperactive. I don't know the reason. In brow area, there is a brow elevator and brow depressors. In mouth corners, there is mouth corner elevator and depressors, you know. And in some ages, the mouth corner depressors is stronger than elevator. At that time, this muscle, zygomaticus major, will be strong. Because of that, muscle contractions, bony resorption occurs, and then fat drops. I told you before, and then skin laxity follows. Today's cog thread lifting aim is malar retaining ligament lifting and below zygomatic arch portion volume augmentation. If we put the fingers here and elevate like this, there is a big movement. like this. I'll show you later. Like this. If we elevate medulla retaining ligaments, medulla fat pad will be elevated and medial cheek pad and lateral fat pad is elevated, including jowl pad. Today's target portion is fat compartment. Fat compartment consists like this: superficial and deep fat. Between them, there is a SMAS, superficial muscular aponeurotic system. If the patient have tough septum, the lifting will make a good result. This is about SMAS or facial muscles. It's about evolution of face, how to fix to mobile faces. Fishes and reptiles, reptiles are hard faces, and mammals have soft faces. What's between them? Facial muscles. Facial muscles are innervated by facial nerve 7. Before going forward, let's look at about the branchial arches. In embryological term, there are 5 branchial arches: 1, 2, 3, 4, 6. Arch 1 makes Mercurius cartilagus and malleus incus and some muscles, mandible and perimandibular muscles, jaw muscles. It is innervated by cranial nerve 5. Second branchial arch is gill muscle. Gill muscle is innervated cranial nerve 7. Like this. It's muscle. This gill muscle comes to constrict the colli muscle, like this. Cranial nerve 7 innervate constricted colli. Salamander and lizard snake has constricted colli like this. These are non-facial cranial nerve 7 muscles. True facial muscles occurs in mammals, like this. Between them, there is some evolution animal. It calls platypus. Its platysma is originated from this platypus. Its evolution is
the name? Yeah. The name of platysma?
Yeah, platysma. Platysma muscle is evolutionary muscle. I'll show you. Platypus has it's from eggs, and it gives off poison like this. But its face, it has facial muscles, not constricted colli. Reptile to mammal, the boundary animal. Constricted colli comes to facial muscles like this. Reptiles, constricted colli. I'm sorry. There's muscle contractions on their edges. After that, there's a neck sagging. Muscle contraction makes skin sagging like that. But in oceans, in waters, there is some pressures there. So it's from the agings. But the black holes, blowholes, nearby the blowholes, there is some wrinkles there, like this area. This area, there is some muscles there, but there is no wrinkles. In mammals, there's some skin saggings as their ages, like human. Mobile fixed face boundary, there is facial muscles. Do you know these pictures from just article? In monkeys, common monkeys, the platysma innervated to the bones, bony insertions. But after some monkeys, we call the primitive platysma, it innervated muscles, perioral muscles. But if there's some more evolutions, the muscle changes into the fascial structures. We call it a parotid fascia, mandrel. So human, like this. The parotid fascia area, there's tough smash, and the anterior portions, soft smash. In that area, there is a soft fat and tough fat. Let's look at this concretely. This is a superficial fat and superficial fascia and deep fat. Deep fat is more soft. It's very tough, soft. This is adipometry, adipose tissue thickness. Periorbital and perioral area less than 3 millimeter. And around the oral cavity, very thick, more than 6 millimeter. But above the auricle, 3 to 6 millimeter, like this. We eat this orange area. We sell. I don't like to put the thread into here. If you make a cork thread, you might have some dimples. This is biopsy photo. Smash thickness is around 0.4 to 0.4 millimeter. And let's look at more. This is a parotid area and cheek and nasolabial area, like this, from here to here. Around the ear, around the ear, superficial fat is more thick, but it's a very tough fat area. But if you go into the oral area, there is a deep fat is developed. This area is mobile smash. In this article, they say mimic connecting plate. It is this area is connected. I told you before, mallar retaining ligament, elevate mallar retaining ligament like this. This plate moves together. So my aim for the thread lifting is elevation of mallar retaining ligament. this photo shows transverse facial artery locations, maybe 3.5 centimeter above the tragus. We have to watch out for the inserting thread. Like this, it moves like a plate. This is the facial arteries, but today we have to watch out area is this area, superficial temporal vessel area. The facial artery is very deep, so we couldn't touch it, this area. I'll show you how to avoid these arteries. This picture is about easy lift. It's a non-observer thread lifting. This is just for the fixed smash lifting. Because with this procedure, we prevent the dimple formation. So I put the thread like this. With aging, there is oral cavity laxity, the inside and outside, the skin and oral mucosa. This is my pictures. Because of the buccal fat pad, there's some skin laxity around this area. If we elevate the skin beneath the subcutaneous fat, and then maybe we experience the relapse after thread lifting. It's from the oral mucosal laxity. We couldn't adjust this laxity. If we elevate the fat like this, there's some muscle movement too. I told you before, this zygomaticus is very low, hypotonic, loose, so it's very high effective in order to make muscle contraction properly. These are so many threads I experienced. If you have today's thread, I'll use this LFL, Anchor Max, and Hub Plus. If you have any questions about this thread, you can ask me anytime.
Would ask now or later?
Later, yeah, after finish.
After finish.
Yeah.
Okay.
Or after doing
We'll
this
focus-
lecture.
We'll focus on this now, and then after we can ask you about
This one also,
Okay.
this one will give very nice rejuvenation of the skin.
Today's main thread is Anchor Max 17 gauge, 100 millimeter length thread like this. This is a lifting part. This area holds the tissues, and then we elevate the thread, and this portion keeps downward slanting. These are other threads. Mint lifting is very sharp tip. If we elevate the tissue tightly, it tears tissues easily. And
Right.
it, yeah, but the patients have tough septum or tough
Right.
fats. It's very effective.
Very good.
Right. But this cutting thread, if it is observer thread, it melts very easily, and it can make also quick drop. Aespio thread is made from molds, and if it melt this area, it's like 원뿔을 뭐라고 하죠?
Cone. It melts
Cone,
with a
cone.
cone
Yeah.
shape.
Yeah, it keeps stay longer, like silhouette soft. If it melts the coal, it looks like a cone. This thread merits holds tissue very easily, and no slippage, and it's not elastic, so it seldom makes dimples. It changes into cone. It makes long-lasting result. I'll show you the designs. We have to make a zygomatic retaining ligament position. This is lateral orbital limb inside point, and it goes down 25 millimeter, and transversely 22 centimeter. And this area there is zygomatic retaining ligament, like this, 2.5 centimeter, 2 centimeter, make like this. Yeah. And this portion 이따가 뭐죠? mouse corner and extension line like this. Here, anterior hairline and inside hairline like this. First insertion point is like this, and then the vertical insertion. It's from the Tonaz technique. He used this vertical lifting. And from here, from tragus, I goes to the mouse corner area. It makes zygomatic below zygomatic arch augmentation. And in order to make mandibular contour, I put the upper thread, and for the leg lifting, I put another thread here. This below the angle area, there is a top fat there. So if we insert the thread, it is elevated very easily. Anchor plus have. It's a 21 gauge and 60 millimeter. If we insert this thread, the gauge is very thin, so it doesn't damage too much tissue damage. It doesn't make too much tissue damages. So, and compared to the cork thread, it is from mold, a very strong corks, like this. There are so many indications, but I like to use the mouse corner elevation purpose, using this puncture area. And below the zygomatic arch area, if I put the thread more, there is a jowl will be improved. This is a video for the thread incision. Do you want to see, or you want to see upside? The real.
You have one for bro lift?
Yes, this is the lifting
I want a pro lift.
No
Oh,
problem.
This is
You're not gonna use that 60.
I seldom use the thread for the brow lifting purpose.
You don't use much.
Yeah, I like to do the operations.
Endoscopy.
Endoscopy, yeah.
No.
I'm sorry.
Because I use it and I'm having good results, but I want to see if you have another technique.
Uh-huh. How?
Uh,
If,
No, I'm just the 21 gauge. I'm using like 3 by 3 from
Oh.
the same entry
oh, really?
with the head,
Mhm.
and it's giving good
Please.
results. I wanted to see if you
Please teach me.
Sorry, the patient is sedated. This is under sedation.
Yeah, IV sedation.
Well, why sedation with the threads?
Patient feels some discomfort if
Yeah,
I
but,
inserting the thread.
But if we are in the wrong plane, it will make severe pain when the patient wake up. So the pain here is my guide.
Oh,
if I'm
yeah.
on the right plane, there is no pain.
Mm-hmm.
Yeah.
Yeah, it's for the device. I like to I don't want to do the floating technique, just the anchoring. I put the two threads together.
How many threads you go per face maximum? If you want to do a full face lift using threads, how many threads?
Depends
Maybe-
on the cases.
Yeah,
I know,
right.
Depends. How
Depends.
much maximum? You can
Maximum 30,
take? I go up to 30 from this. From the
not
18.
the big one. Big one I usually use
I'm talking about
20.
the 18 gauge or the 17 gauge 100. How many threads can you use for the mid face and the lower face?
Sometimes 8,
20
very old.
17 gauge thread, full faces, and 60 millimeter maybe. It depends on the patient cases.
Sorry, doctor. Here you use two different type of threads.
Yeah,
Polycarpylactone and PDO, or all.
the same PDO thread.
No, but one is white.
One is a little bit
BCL and BTO.
for the
start with the name.
not the lifting purpose, just the staying.
Just to stay inside.
Staying, and another one is lifting purpose, and put together.
One is just for collagen.
You use polycarpylactone and PDO, right?
Polycarpylactone, you'd better to put this below zygomatic area. It makes some volumes,
Volume. Okay.
like a Elance.
Okay.
Yeah, if you use Silhouette Soft, there's some. If you put the Silhouette Soft floating with the floating type, the thread moves back and forth, and if thread goes to the anterior faces, there is some anterior volume augmentation occurs. Yeah, it makes some bad result.
So you do sedation for the patient, like 10 minutes, 15 minutes, you finish,
Yeah.
and you wake them up. The position here, it will not affect the anatomical landmark when the patient lay down. and
Yeah,
spine.
when patient lay down. Yeah.
It's much better to do like
Like
90,
little bit
90
sitting.
or semi-sitting.
뭐라고 하지?
앉아서 하는 거랑 누워서 하는 거.
When it is sedating, the skin will be loose, and when it's laying down,
Oh, yeah.
the line that you already just draw.
So yeah,
Before
sedation,
make
I design in the sitting or standing position.
And go back, especially for the mid
marking before.
and the skin go back.
These are results. 26 year, 3 months post-op. The similar technique, like this. I'll go maybe 8 on one side, 8 to 10 for one side. 37. 2 weeks later. Three, 4-year-old, 2 months, 2 weeks later. Yeah, 2 months
Excuse me,
later.
for this case, how many threads have you used and what kind? 60 or 100 and which gauge?
The same, thread. 17.
So you used how many 17?
10, usually 8 to 10 for the young people.
For young people, you used on this side 17 gauge,
Right.
100 centimeter,
Right.
and 8 on this side.
8 to
Right,
10.
8 to 10.
So the total is like 16 to 20,
Yes.
18 gauge, 100 centimeter, 100.
17 gauge.
Yeah.
17
Yes,
gauge.
17.
Yeah, I'll do the
Usually for
same
the
procedures in the, upstairs.
Perfect. I want to know the.
Yeah.
What's an affordable?
Here. This is 10 days later. Yeah.
This
It-
is
it-
for 10 days later.
Maybe. If it's time, maybe 1 or 2 months later, this portion will be augmented. This jowl will be improved more.
So
Immediate lifting effect. Yeah, just 10 days.
yeah, great. I have a question. So you have the patient. You did for her the thread lift procedure, and the patient will look at herself. What do you tell her exactly? You tell her this is 50% of the result, this is 40% of the result, this is 60% of the result, and the patient always will ask you, when will I get the final result?
2 months later.
So you usually tell them 2 months to have, but the actual direct effect that the patient see after the procedure, in your opinion, as a doctor, from your experience, what do you tell the patient? This is what, when she looks at herself, okay, there's an improvement. What do you tell her? This improvement represents how much percentage? This is because many patients in our countries ask us, this what we have now a lift, direct. You tell us that due to collagen and elastin stimulation and all this stuff, you're gonna after 1 month or 2 months have more lifting. What percentage do you tell them that you get directly after the procedure?
바로 시술 직후에는 몇 퍼센트 정도로 이야기를 하고 그다음에 이제 한두 달 지나면 더 올라가잖아요.
네.
그래서 바로 시술 직후에는 몇 퍼센트 정도
시술 직후엔 몇 프로? Maybe these patients from their friends, they do the procedures from me, and they know the processes. So I don't have any.
Not for this patient, he asked generally for me.
대략적으로는 보통적으로 한두 달 뒤엔 더 큰 효과를 보잖아요.
맞아요.
근데 그제 바로 직후에는 몇 퍼센트 정도
The question here, which one before and after? Which one before and after?
Yeah, before and after.
Before and after.
Yeah.
What do you think? This after 2 months?
10 days.
10 days. Okay. In your opinion, what the percentage of improvement he's asking in 10 days? Do you think like
There's some direct lifting effect here.
yeah?
Yeah, there's some swellings there. The swelling degree of the swelling is very different.
Yes.
Maybe in some cases there is some mela swelling there,
Yeah,
and then don't like this. Yeah, my
Normally, doctor, when we do the treatment, immediately I see skin tightening, and after 6 weeks, I start to see the baby collagen, the glowing and the skin texture improvement. After 3 years, mature collagen will be there.
collagen comes to around the thread after
Collagen type 3, yes.
3 weeks. Yeah.
3 weeks.
Yeah,
when the
maybe if you use
inflammatory
some other component of the thread, maybe if you use polycaprolactone and PLA thread, maybe there is more tissue reactions there.
Yes.
This is a
My
PDO thread.
patient, they don't have swelling or bruising, no reaction, immediately tightening result, and for 3 weeks.
The material.
Uh-huh.
If you use PLA.
Please, I'm so sorry, but at the moment we need to do the procedure because of the
yes.
time. Can we do procedure?
Yeah.
Yeah, thank you.
How's do the design in here?
He will do the designing right here. So,
The marking, okay.
yes.
Okay.
여기 잠깐 환자분 오시라 하지. 이쪽으로 오시라 하세요. 앉아서 보시면 되죠.
بتخدر sedation.
네, 이쪽으로 오시겠습니까?
And what about the local anesthesia about?
여기 몇 살이? 혹시 연세가 50?
منتخب
57 years old.
The patient is
Lady.
57 years old.
네, 잠깐 벗어주실래요? I met her before. She has good skin tone there, not too much lifting
Can you see?
skin. I'll make design like this. Okay. 책 약간만 줘주실래요? The points I told you before. 이좀 한번 도와주시면 좋은데. 이쪽으로 할게요. And superficial temporal vessels around from here to 1 to 2 centimeter area. The vessel arteries exist here. We have to watch out. If we come down like this, we have to if you insert the thread, we have to touch it. We have to avoid it. There's mandible and facial vessels maybe around
No.
1/4 area. It comes to like this. So, but it's very deep.
If you can, I will let you.
From here to here.
This is videotape. Will you give us the tape at the end of the whole
Yes,
presentation?
they were gonna edit it and,
And-
put the subtitle.
Another one is here.
Presentation. You can have the slides and the video.
Oh, you need a presentation? The presentation too?
Okay, let me
At least
have
the
another.
technical part of the
this thing.
presentation and the video.
No.
At least the video of the procedure, the design,
Mm-hmm.
and the procedure of this we need to stay.
Yes.
Stay.
Okay.
Okay. She'll go upstairs and